Arteries of the face. Features. The face is richly vascular. It is supplied by the facial artery, the transverse facial artery, and arteries that accompany the cutaneous nerves, which are small branches of ophthalmic, maxillary and superficial temporal arteries. Competency achievement. The student should be able to describe and demonstrate origin, formation, course, branches, tributaries of facial vessels. Facial artery, facial part. The facial artery is the chief artery of the face. It is a branch of the external carotid artery given off in the carotid triangle just above the level of the tip of the greater cornua of the hyoid bone. In its cervical course, it passes through the submandibular region, and finally enters the face. Course. It enters the face by winding around the base of the mandible, and by piercing the deep cervical fascia, at the anteroinferior angle of the masseter muscle. It can be palpated here and is called anesthetist's artery. First it runs upwards and forwards to a point 1.25 cm lateral to the angle of the mouth. Then it ascends by the side of the nose up to the medial angle of the eye, where it terminates by supplying the lacrimal sac, and by anastomosing with the dorsal nasal branch of the ophthalmic artery. The facial artery is very tortuous. The tortuosity of the artery prevents its walls from being unduly stretched during movements of the mandible, the lips and the cheeks. It lies between the superficial and deep muscles of the face. The course of the artery in the neck is described in submandibular region. Branches. The anterior branches on the face are large and named. They are inferior labial to the lower lip, superior labial to the upper lip and the anteroinferior part of the nasal septum, lateral nasal to the ala and dorsum of the nose. The posterior branches are small and unnamed. Anastomoses. The large anterior branches anastomose with similar branches of the opposite side and with the mental artery. In the lips, anastomoses are large, so that cut arteries spurt from both ends. Small posterior branches anastomose with the transverse facial and infraorbital arteries. At the medial angle of the eye, terminal branches of the facial artery anastomose with branches of the ophthalmic artery. This is, therefore, a site for anastomoses between the branches of the external and internal carotid arteries. Transverse facial artery. This small artery is branch of the superficial temporal artery. After emerging from the parotid gland, it runs forwards over the masseter between the parotid duct and the zygomatic arch, accompanied by the upper buccal branch of the facial nerve. It supplies the parotid gland and its duct, masseter and the overlying skin, and ends by anastomosing with neighboring arteries.